So the CAPC curriculum around opioid prescribing exists to address that gap in medical education and education in general for all clinicians that are interfacing with patients with serious illness, to give them a baseline of core skills to know how to do a comprehensive pain assessment, how to do screening and for opioid use disorder or opioid misuse, and then stratifying those patients the best that we can so that we know how to do surveillance when we actually do start somebody on it. So we have a pain management unit that really starts from how do you do a comprehensive pain assessment, how do you pick the right medication for the right patient, when do you start escalating in terms of what you're going to prescribe, how do you initiate an opioid trial, how do you monitor and continually screen for red flag behaviors or opioid misuse, and right through to how would you document this in your chart and conduct your visits in a way that continues to monitor patients so that you can safely and effectively treat their pain. Another phase of the CAPC training is really directed towards those folks who have substance use disorder or opioid use disorder and also at the same time serious illness. And that curriculum is really powerful because that is a pain point for anyone who's done office-based practice, which is we know those patients are in our offices. We don't have the training to know how to address their pain, but also acknowledge and address and treat to the extent that we can their substance use disorder. And this series of courses really goes through definitions. What is opioid misuse? What is substance use disorder? What is opioid use disorder? How are they the same? How are they different? How do you predict who may be at higher risk for these? And how then, once you've predicted risk, do you go about mitigating? And again, this idea of universal precautions comes into play. We know that all patients carry some risk. So rather than trying to use tools, even though they exist, they're not, the studies are mixed on how well they actually do predict this risk. So applying universal precautions, which is assuming everybody has some amount of risk, we are able to construct ourselves or operationalize a way to take care of patients with serious illness and substance use or opioid use disorder in a way that addresses both of their needs.